Methylmalonic acidemia with homocystinuria, or MMA+HCU, is a genetic metabolic disorder, IEM, with several types. The most common form is cobalamin C deficiency, or CblC, while other types like cobalamin D deficiency CBLD and cobalamin F deficiency CBLF are rarer. Today we'll focus on CblC. CblC doesn't just affect the nervous system, it can also lead to complex psychiatric symptoms such as hallucinations, delusions, cognitive impairment, and depression. Many patients are initially misdiagnosed with psychiatric disorders because of these symptoms. However, recent research shows that dietary management is critical for CblC patients. Nutrients like vitamin B12 and folic acid play a direct role in how the disease presents and how effective treatments are. In today's video, we'll explore how metabolic issues in CblC patients trigger psychiatric symptoms and how proper diet and metabolic treatment can help alleviate symptoms and improve their quality of life. CblC type MMA plus HCU. CblC type MMA plus HCU is an autosomal recessive genetic IEM disorder and the most common form of cobalamin, vitamin B12, metabolism disorder inside cells. This condition is caused by mutations in the MACHC gene. Normally, the protein encoded by the MACHC gene plays a crucial role in the cell. It helps convert vitamin B12 into two essential coenzymes. The first is methylcobalamin, MECBL, which is a coenzyme for methionine synthase. Without it, homocysteine levels rise and methionine levels drop. The second is adenosylcobalamin, ADOCBL, which is a coenzyme for methylmalonyl-CoA mutase. A lack of ADOCBL leads to the buildup of methylmalonic acid. Vitamin B12 has many vital functions in the body. It is crucial for the normal functioning of cells, tissues, and organs, especially in processes like methylation, DNA and RNA synthesis, neurotransmitter production, and energy metabolism. The protein encoded by the MACHC gene also helps activate B12-dependent enzymes that are involved in these key physiological processes. So, when a mutation occurs in the MACHC gene, metabolism is affected, impacting not only the nervous system but potentially other systems as well, including the kidneys, heart, lungs, immune system, endocrine system, and blood vessels. 2. Clinical manifestations of CblC. The clinical manifestations of CblC are complex and diverse, affecting multiple systems and organs in the body. Some of the most common symptoms include, first, neurological symptoms, such as issues with the peripheral nerves and spinal cord, which may lead to weakness in the lower limbs, muscle spasms, and reduced strength. Brain damage is also common, often accompanied by cognitive impairment and memory loss, sometimes even resembling dementia. Next, there are psychiatric and behavioral changes. Many patients experience depression and anxiety, with some even having hallucinations, delusions, and other psychiatric symptoms. In severe cases, this can lead to behavioral confusion and social withdrawal. Then, motor disturbances like unsteady gait are common. Many patients report difficulty walking or weakness in their legs. Some may also experience seizures. CblC doesn't just impact the nervous system. Patients may also experience complications in the heart, lungs, and kidneys, such as blood clots, pulmonary hypertension, and heart failure. The clinical presentation varies greatly depending on the age of onset. Early onset CBLC typically shows symptoms in infancy or early childhood, including feeding difficulties, growth delay, low muscle tone, and seizures. Late onset CBLC, however, may not appear until later childhood, adolescence, or even adulthood. The symptoms are more subtle and can easily be misdiagnosed as other conditions like neurodegenerative diseases, white matter disorders, spinal cord diseases, or even psychiatric disorders. 3. Clinical diagnosis of CBLC. If a doctor suspects that a patient may have CBLC, they should immediately perform a series of tests, including organic acid urine tests, serum levels of methylmalonic acid, MMA, homocysteine, HCY, plasma amino acids, and acylcarnitine profiles as part of the metabolic screening. These tests help identify metabolic disorders, particularly elevated MMA and HCY levels. It's important to note that vitamin B12 and folic acid levels are usually normal, which is why relying solely on routine B12 tests can sometimes lead to missed diagnoses. Additionally, methionine levels are typically low because CBLC affects the remethylation process, disrupting crucial biological processes such as neurotransmitter synthesis and energy metabolism. An elevated C3 acylcarnitine level is another key indicator, suggesting issues with adenosylcobalamin production. CBLC is a multisystem metabolic disorder. In addition to metabolic disruptions, patients may experience complications in areas such as oxidative stress, blood vessels, coagulation, kidneys, and the heart and lungs. For this reason, the disease has a systemic and chronic nature. For a definitive diagnosis, genetic sequencing is the gold standard. With genetic testing, doctors can directly confirm mutations in the MMA+HCU gene, rule out similar conditions, and ultimately confirm CBLC. 4. Early treatment and prognosis of CBLC. Diagnosing CBLC can be particularly challenging, especially in patients with the late onset form. This is because the symptoms are not typical and the disease progresses slowly, often being misdiagnosed as psychiatric disorders, neurodegenerative diseases, white matter disorders, spinal cord diseases, or even age-related cognitive decline. Due to the subtle symptoms, many patients are not diagnosed until they experience significant neurological or kidney complications, or even severe disability and life-threatening conditions. By that point, the prognosis is already heavily impacted. Early diagnosis and timely treatment are crucial for improving outcomes. With prompt metabolic treatment such as high-dose hydroxocobalamin, cobalamin, betaine, folic acid, and L-carnitine supplementation, it is possible to effectively lower homocysteine, HCY, and methylmalonic acid, MMA levels. This helps improve methylation pathways and energy metabolism, significantly enhancing the patient's neurological and cognitive functions. Studies show that early treatment not only reduces neurodegenerative changes, but also helps alleviate psychiatric symptoms. However, CBLC is a chronic, lifelong metabolic disorder. Even with treatment, patients may still face residual neurological, cognitive, motor, or organ-related complications. Therefore, long-term monitoring and multidisciplinary management are essential to ensure continuous health care and intervention. 5. Neuropsychiatric symptoms of CBLC. In late-onset CBLC patients, neuropsychiatric symptoms can be quite complex, ranging from mild cognitive and mood changes to severe psychiatric symptoms, behavioral changes, and even cognitive decline. In terms of cognition, many patients in their adolescence or adulthood experience memory loss, difficulty concentrating, and even executive function impairments. Some patients may have symptoms resembling dementia, Emotionally, depression is often the first sign of CblC, with many patients being misdiagnosed with depression due to symptoms like low mood and social withdrawal. In addition, some patients may also experience manic symptoms, including mood swings, irritability, and other emotional instability. More severely, some late-onset patients may develop psychotic symptoms, such as hallucinations, delusions, confusion, and abnormal behavior. These patients may require psychiatric treatment due to repeated psychotic episodes. Fortunately, many psychiatric symptoms improve significantly with metabolic treatments, such as vitamin B12 and betaine supplementation, further supporting the link between these symptoms and metabolic disruptions. Behavioral and social functioning are often affected as well. For example, many patients undergo personality changes, experience social withdrawal, and may react unusually to external stimuli, showing emotional fluctuations, impulsivity, or aggression. Psychiatric and neurological symptoms often alternate, significantly impacting the patient's daily life and social interactions. Additionally, some patients may experience confusion, disorganized behavior, or even delirium, often without clear triggers. When these symptoms appear, doctors should be more alert and consider the possibility of metabolic diseases, IEM. It's also important to note that while early-onset CblC typically manifests in infancy, a small number of children and adolescents may show signs of ADHD, learning difficulties, behavioral problems, or even developmental delays. This suggests that the neuropsychiatric symptoms of CblC can affect patients at various stages of life, from childhood to adulthood, impacting their growth and daily life. 6. Mechanisms of psychiatric symptoms in CblC. CblC is not just a metabolic disorder, it impacts the brain and nervous system in various ways, ultimately leading to psychiatric symptoms and neurological dysfunction. Let's take a closer look at how these issues arise. First, CblC is caused by mutations in the MAPLHC gene, which is responsible for converting vitamin B12 into two essential coenzymes. Without these coenzymes, the body experiences a series of metabolic disruptions, leading to the accumulation of homocysteine, HCY, and methylmalonic acid, MMA, which severely affect the brain and other organs. The impact of these metabolic disturbances on the brain is especially evident. The lack of active vitamin B12 disrupts methylation reactions, affecting the synthesis and repair of DNA, neurotransmitters, and membrane lipids. This can lead to cognitive decline, mood swings, and other issues. The accumulation of CY and MMA can also damage the structure of nerve cells, causing neurological damage and psychiatric disorders. Furthermore, elevated MAMA affects mitochondrial energy metabolism, reduces brain neuroplasticity, and even worsens oxidative stress and inflammation, common mechanisms in mental health conditions like depression. Over time, these disruptions can cause brain degeneration, resulting in severe outcomes such as white matter lesions and brain atrophy. In addition to these effects, CblC also impacts neurotransmitter synthesis, leading to mood disorders, cognitive decline, and even symptoms like seizures, hallucinations, and delusions. Brain imaging studies can reveal typical CblC features, such as white matter lesions, brain atrophy, and damage to the cerebellum and basal ganglia. These findings provide anatomical and pathological evidence for the psychiatric symptoms. Finally, CblC's neuropsychiatric abnormalities share many similarities with genetic metabolic brain diseases, GMBDs. Both involve the accumulation of metabolic products caused by gene mutations, leading to toxic damage to nerve cells, demyelination, and neurotransmitter abnormalities. As a result, CBLC patients often show similar cognitive, mood, and behavioral disorders. Understanding these metabolic mechanisms helps us better comprehend how CBLC affects patients' neuropsychiatric health and provides strong support for treatment. 7. Case study of a CBLC patient. 1. A girl's mysterious psychiatric symptoms. Today I want to share the story of a 13-year-old girl named Lily, a pseudonym, whose experience sheds light on a rare and often overlooked disease, especially when it comes to diagnosing adolescents. Lily was a healthy girl with no significant family medical history. However, about a month ago, she suddenly began experiencing severe psychiatric symptoms. She started having hallucinations and severe sleep disturbances, unable to fall asleep at night and often feeling confused and exhausted during the day. At first, her family thought it was just stress or emotional fluctuations, but her condition continued to worsen. Lily not only lost interest in her usual activities, but also had a significant loss of appetite and rapidly lost weight. Her family didn't realize that these symptoms might be linked to a more serious health issue. As her condition worsened, Lily's mental state deteriorated further. She began showing signs of confusion, poor eye contact, and emotional blunting. Her family took her to the hospital, where the psychiatrist initially diagnosed her with acute stress disorder and started treatment, but Lily's symptoms didn't improve. Things took a turn for the worse when she began having seizures and trouble walking, which caused the doctors to take the situation more seriously. Despite a series of tests, including a CT scan and preliminary neurological exams, nothing significant showed up. However, an MRI revealed abnormal signals in her cerebellum, and the EEG showed seizure activity in the left temporal lobe, along with diffuse encephalopathy. This led the doctors to suspect that Lily might have a genetic metabolic disorder, IEM. After further testing, Lily was diagnosed with CBLC type MMA+HCU, a rare IEM metabolic disorder related to vitamin B12 metabolism. CBLC is a rare condition typically caused by mutations in the MACHC gene, which affects the conversion of vitamin B12. This disease impacts the nervous system, mental health, and even various bodily functions. In Lily's case, because she had the late onset form, her symptoms didn't appear as early as the more typical early onset form, but instead emerged during adolescence. Once diagnosed, Lily began treatment, including high doses of vitamin B12, hydroxocobalamin, betaine, and folic acid. After several months of treatment, Lily showed significant improvement. Her weight gradually returned to normal, and her mental state improved as well. The hallucinations and confusion symptoms disappeared, and her appetite started to return. Lily's story highlights how CBLC, MMA+HCU, a rare IEM disease, can present with very prominent psychiatric symptoms in adolescence, including hallucinations, depression, and cognitive issues. The diagnosis of this disease is often delayed because its symptoms can mimic many common conditions and are complex and varied. Early metabolic screening and timely treatment are crucial for recovery and can significantly improve prognosis. I hope Lily's story reminds us that, especially when adolescents show unexplained psychiatric symptoms, we shouldn't overlook the possibility of a metabolic psychiatric disorder. Early diagnosis and treatment can help patients recover and lead a better quality of life. 2. The miraculous treatment of late-onset CBLC. This patient's story comes from a family with 3 adult women, all of whom have had treatment experiences that highlight the remarkable effectiveness of high-dose hydroxocobalamin in alleviating psychiatric symptoms and improving neurological function. First, our main subject is a 28-year-old woman named Lisa, a pseudonym. She had always been healthy, with the occasional migraine, but no major health issues. However, in recent months, her health took a dramatic turn for the worse. Lisa began experiencing severe psychiatric symptoms, including hallucinations and paranoid delusions, feeling constantly under threat. Her mood became increasingly unstable, and she became highly anxious, even experiencing blurred vision. As time went on, her symptoms worsened. She began to show cognitive decline, such as incoherent speech and memory problems, eventually progressing into acute psychosis with frequent panic attacks, poor coordination, and even an inability to walk independently. Her symptoms progressed rapidly. In just 3 months, she was hospitalized multiple times due to severe mental confusion and neurological impairment. Doctors conducted several MRI scans of her brain and spinal cord, which revealed extensive white matter damage in her brain and basal ganglia. These imaging results provided clues for her subsequent treatment. Lisa received standard psychiatric treatments, but her symptoms showed little improvement. The doctors began to suspect that she might have a genetic metabolic disorder, IEM, and ordered metabolic screening. Ultimately, Lisa was diagnosed with CblC type MMA+HCU, a condition affecting vitamin B12 metabolism and causing significant damage to the nervous system and mental health. After the diagnosis, doctors started her on a standard dose of hydroxocobalamin treatment, along with betaine and folic acid. While there was some biochemical improvement initially, Lisa's psychiatric symptoms and neurological damage did not significantly improve. At this point, the doctors decided to increase the dosage using high-dose hydroxocobalamin and added Metinex, a combination of L-methylfolate, pyridoxal 5'-phosphate, and methylcobalamin. After some time, Lisa's symptoms dramatically improved. 2 months into the treatment, Lisa's psychiatric symptoms completely resolved. The paranoid delusions and hallucinations disappeared, and her unsteady gait showed significant improvement. More importantly, her urinary function returned to normal, and her gait improved enough that she was able to walk independently with the aid of a walker. Additionally, MRI scans showed significant improvement in the white matter lesions and basal ganglia damage, with the affected areas visibly shrinking. However, Lisa's case doesn't fully represent the experience of all CblC patients. Her 2 sisters also have the same genetic mutation, but their symptoms are much milder, with one even being asymptomatic. Possible reasons for this include genetic variability and environmental factors. However, Lisa's vegetarian diet may have made her condition more complex and severe. Her diet led to deficiencies in essential amino acids, especially methionine, and vitamin B12, both of which are critical for the metabolic pathways of CblC patients. Low methionine levels can severely affect the nervous system, leading to cognitive and motor dysfunction and increasing the risk of eye complications. So, her vegetarian diet may have exacerbated her metabolic imbalances, particularly in the nervous system. From Lisa's story, we can see that CblC is not just a metabolic disorder, but it can also be closely linked to dietary habits. Timely treatment, especially with high doses of vitamin B12, can significantly improve symptoms. We hope that Lisa's experience serves as a reminder that early diagnosis and treatment are crucial for improving the quality of life for CblC patients. At the same time, for CblC patients, especially vegetarians, proper nutritional management is an essential part of treatment that should not be overlooked. Conclusion: through the study of CblC patients, we gain a deeper understanding of the profound impact that genetic metabolic disorders, IEM, can have on mental health, especially when key metabolic factors like vitamin B12 and methionine are involved. Managing diet, particularly ensuring adequate vitamin B12 in intake and overall nutritional balance, plays a crucial role in controlling metabolic disruptions and alleviating psychiatric symptoms. At the same time, metabolic treatments, such as the use of hydroxocobalamin, folic acid, and betaine, can effectively improve neurological function and cognitive abilities. Early diagnosis and timely intervention for CblC patients not only help manage metabolic disturbances, but also reverse brain damage, as well as spinal cord and brain injuries, enabling patients to achieve a better quality of life. Therefore, proper diet and timely metabolic treatment are two key factors in managing CblC patients. We hope this article will raise more awareness in the medical community and among the public about metabolic psychiatric disorders, bringing hope and improvements to more patients with mental health challenges. If you're interested in stories about genetic metabolic disorders, IEMS, and their connection to mental health, what we call metabolic mental disorders, don't forget to like, subscribe, and share this video with anyone who might need to see it.